Adolescent Health Symposium, hosted by People's Center for Adolescent Health. Thank you for sharing your precious time with us this evening. My name is Candace, and I'm the lead care team RN for the Adolescent department. Presenting with me this evening are Luann Verrier, a nurse practitioner, and two of our Youth Advisory Council members, Maria MALBAS and MADISON GRANIER. I'd like to start the introduction with Luann Verrier.
Hi, everybody. Thank you, Candace, and thank you, everybody, for being here with us and celebrating International Adolescent Week. I am a nurse practitioner at People's Community Clinic, and I am a fourth-generation nurse. I'm also a second-generation family nurse practitioner. I received my nursing education at Columbia University in New York City. I completed that in 2007. I then worked with homeless families in shelter settings for a couple of years before moving on to a private practice with more high-touch clients. And then finally, before moving to Texas, I did a stint in college health at Pace University in Lower Manhattan. And I arrived at PCC in 2016. I'd also like to now let Maria and Madison introduce themselves. They are also presenting with us, and we are very thankful for that. They're members of our Youth Advisory Committee. So Maria.
Hi, good evening, everyone. My name is Maria. I'm a third-year pre-med neuroscience major at UT Austin. I'm also part of the Youth Advisory Council, and I am really excited to be part of this event. My mom happens to be a nurse, and so I'm looking forward to our discussion.
Hey guys, I'm Madison. I'm also a member of the Youth Advisory Council. I graduated Southwestern University in 2019 with a bachelor's in science in biology and a minor in Spanish. Since then, I've been working in healthcare, and I'm applying to graduate school for this fall.
Thank you, everyone. I have been a nurse for over 25 years. I've worked in several specialties covering the entire life spectrum, from maternal and child health, pediatrics, adolescent, adults, and even radiology. During my years at 20 years at People's Community Clinic, I have spent time as a nurse, a team leader, a mentor, a trainer, and an interim nursing supervisor overseeing the nursing, medical assistant, referral, and the pharmacy departments. In the last 5 years, I have focused on the adolescent and young adult population, where I help to coordinate patient care and support patients and their families in self-management, self-efficacy, and behavioral change. In my current role, I balance work with 8 different providers across 3 clinical sites and to perform nursing duties along with triage, case management, peer-to-peer review, medication reconciliation refill, and continue to serve as a resource to our LVN and medical assistant and MA supervisor. A patient's or a patient first contact involves our call center. Those calls involving a mental health issues or questions that are escalated to our LVN, Margaret, or myself. During those calls, we collect information regarding the nature of the complaint or questions. Call can range from something minor, such as someone experiencing mild COVID-like symptoms, or effects from a recent STI, to something more severe, such as an acute respiratory symptoms, to someone in a mental health crisis, having suicide ideations or attempts to self-harm. Based on the collected information, Margaret and I determined the best course of intervention, be it teaching and management, scheduling a provider's appointment, contacting the emergency room, or reaching out to a mental health officer. Regardless of the reason for the contact, the object is patient safety while the necessary resources are obtained. If the patient is being referred to the emergency room, we call the report to the ED triage nurse. We act as a soft handoff and helps to expedite the evaluation and alert the medical team of the incoming patient status and signs and symptoms. If a mental health referral is needed, I keep the patient on the line and generate a conference call with the mental health provider. We follow up on all emergency room and mental health referrals. During this follow-up, I check on the patient's symptoms, outcome of their evaluation or visit, medications, and any specialty referral. Additionally, I schedule patient follow-up visit with their PCP to ensure continuity of care, and for those with complex medical histories and diagnosis, I act as their case manager to ensure they are receiving the necessary services, have access to affordable medication and specialty services, and work with them to prevent re-entry into the emergency room in order to obtain positive health outcomes. I will often give patients my direct phone number so that they may have direct access to me when my services are needed. Margaret and I work diligently every day to show our patients compassion and exceptional care in an effort to ensure that they receive timely evaluation and assistance without the added burden of the dismissiveness or costly medical care. It is important to me to work with this age group because I feel very strongly that our youth and young adults are our future, that they are much stronger, braver, and resilient than we give them credit for. And they will, if given the tools, lead us into the next century. Thank you. Luann?
Well said, Candace. Well said. So once Candace has done the triage, patients are funneled into 4 avenues. One of those would be the ER. We hope not, but sometimes it is. The next would be potentially a droplet slot, which would mean potential COVID symptoms. So we would take extra precautions and use PPE for those visits. They would be also funneled potentially into a non-droplet in-person slot, which would not require PPE, or they may be given a virtual appointment. So I would just want to add that by the time they reach their appointment with one of us, our nurses have done so much background work and investigation and history taking and due diligence that it often makes receiving those patients much easier and less intimidating because oftentimes they may be overbooked. So I just want to applaud our nurses and how much work they do on that front. So thank you, Candace. So what happens with me? Well, I'm going to collect more history. I'm going to do a review of systems. I'm going to look at the vital signs if those are available. And then I'm going to assess and evaluate the patient and decide the diagnosis and the plan. That may entail in-house testing, COVID testing, strep testing. We've not done nearly as much flu testing as we have influenza testing, A or B, this past year as we would have done in previous years. It might entail strep testing, a UA, just to gather more data and labs. And I think we also wanted to touch a little bit, correct me, Candace, did we want to go into the challenges next?
Yes, if you're done with your part, yes, if we could do that.
Okay, so in terms of the challenges with the triage, and in particular over this last year with the pandemic, and I think everybody can appreciate this, we've often found that our patients may not have the technology or their technology is not working or our technologies are not meshing as we had hoped during a visit. That can cause great challenge. Also, the appointment may not be kept, and so a lot of work has already gone into making sure that they are going to get seen, hoping that they're not going to go to the emergency room. As I said, Candace and Margaret have already put a lot of effort into making sure that our patients have access to us. And we really don't want them to miss that appointment or be late to that appointment, especially if we're working them in. And this has come up quite often. They, if we are suspecting COVID, quite often they don't feel the urge or need to follow the self-quarantine guidelines, or it seems sort of mishmash within the household as to how everybody is active and participating in that, which can make us as healthcare providers and those trying to watch out for public health a little nervous. And with the virtual visits, oftentimes patients' parents are not with the patient for the visit, or vice versa. The parent is there, but the patient is not. So either there's a loss of information that we feel is usually very necessary. So that can be hard. And then finally, the advice of limiting social activities or community activities, or when we know that they've had a positive diagnosis of COVID. So those have been some real challenges for us in dealing with the triage of potential or suspected COVID patients, whether they're in the clinic or being seen virtually. Does anybody have any questions for us so far? See, we've got 26 participants. Hi, everybody. Thank you for being here. Hi, Dr. Hutchinson. So the next thing that we want to do is bring in members from our Youth Advisory Council, our YAC. As we introduced earlier, we have Maria MALBAS and we have Madison Granier. I hope I said it right. I practiced earlier. And we wanted to do a Q&A with them. We wanted to hear about how they had experienced this pandemic. And if I can share my screen, I'm sorry about the dog barking. If I can share my screen, let's see here. Bring up my PowerPoint. Okay. So now let's share. Okay. All right, I hope it's, Madison, can you give me a thumbs up if it's visible? Okay, thank you. All right. So I'm just going to review our questions first, and then we'll get back to question 1 and start the conversation. We welcome anybody to add additional comments and feedback and join in, ask other questions. So if Stephanie, you can keep your eye out on the chat and hand raising, we'd appreciate that. So the first question is in the theme with what I was saying before, is what the view on the youth engagement during the pandemic has been. We want their personal view. Next question, what barriers or challenges have youth experienced in regard to health care access and health outcomes during the pandemic? Question 3, what is their perspective on unmasking? Question 4, how do you see youth engagement after the pandemic, once 85% of the population has been vaccinated? We hope we get there soon. about 85%. And question 5, how have your familial, personal, and social relationships been during the pandemic? And what has been helpful and what has been hurtful? Okay. So Candace, I'm going to turn this back over to you.
Okay. Hi, everyone. So let's start with question 1, Maria Madison, and anyone else, please. Our goal for this evening, obviously, is to gather more information. Our hope at the end of this presentation is that we all walk away learning something, and hopefully for my part, I want to learn from you. I want to learn how we could, if we're not doing it already, how do we meet the needs of our youths, and how can we better our services if we're not doing that already. So the first question is, what is your view on youth engagement during the pandemic? Maria Madison.
For me, I feel like youth engagement during the pandemic is sometimes like both high and low depending on the situation. I understand that a lot of youth members are experiencing a lot of compassion fatigue, burnout, isolation, etc. So sometimes it can feel like engaging isn't the most appropriate thing to do, but in regards to social media, for example, sometimes I would say youth feel more engaged to participate because it's online and they can reach like more people. And of course, when it comes to like, for example, Instagram, at least for me, like the people that I follow are within my age range. So I know that we're experiencing a lot of the same things. So when I know that I'm not alone, I tend to engage more.
Yeah, definitely going off what Maria said. I felt like a lot of people are very empathetic with the situation, and other people definitely trying to help out. But I also get, a real sense that we're in a year to the pandemic, and a lot of people are tired and just ready for things to go back to normal. Some people, that's very anxiety inducing for them. Other people really just wanted to go on spring break. So it's kind of just depends on different people's situations. But I feel like there's a big collective, like you said, empathy fatigue and care, compassion fatigue.
And I think social media outlets have probably just skyrocketed in terms of participation because, we pick up our phones all the time. It's safe, right? Is it healthy? Who knows how healthy that is? But I can't really imagine how many people have just spent hours and hours and hours on Instagram and Facebook and Snapchat, and who knows how many more there are out there. So that's a really good point, Maria.
Maria Madison, I have a follow-up question on that. Do you find that the pandemic has brought more people onto social media and having more connection, whereas prior to the pandemic, they might not have that kind of connection?
I definitely do. I mean, before the pandemic, I was on, Facebook and Instagram and everything. I'm a little bit older in the youth age group, so I'm in that generation that once the pandemic hit, we all got on TikTok. I don't know if you guys have heard of it. It's just that video app. Lots of people joined that when the pandemic started because there really wasn't else anything to do.
Okay. Does anyone else have a perspective on this first question in the audience?
Sorry, just to kind of piggyback, exactly everything they're saying is what we're seeing when we have youth in our sessions on the community colleges. It's like they want to participate, but they're also really burnt out, and we'll be on, and it'll just be us sharing our screen, and then it's pitch like nobody else is sharing your screen. So it's definitely challenging for our team as well to figure out what's going to meet the youth where they're at and their comfort level.
Thank you, Kelsey, for sharing that viewpoint. I really appreciate that. Can we move on to the next question, please?
Sure.
What barriers or challenges have youth experienced with regards to healthcare access and outcomes, Madison and Maria, for yourself or for people that have shared information with you? Would you share that with us?
From my understanding, what I've heard in one of my classes is that a lot of students are experiencing or struggling with their mental health right now. However, there's just not enough capacity or like resources to help those students. So I think like it is very challenging when something wrong is happening or you're feeling like something is wrong, but there's just not enough resources to help you.
Kind of going off that, definitely a big crisis like with mental health and everything, but also with the pandemic specifically, a lot of providers have had to cut their hours or switch to telehealth or reduce staff, which limits the appointments, but also there's this wave of people experiencing mental health issues. So the demand of appointments is going up, but the actual appointment amounts for some clinics are actually going down. So it just leads to long wait times. And I think it took me about 4 months to get into my primary care doctor. So it just took a while.
Oh my goodness.
Yes, the statistics regarding mental health are just astronomical. And I was on the phone with a former colleague on my way home from work today, and we were discussing that exact same thing and how so many people, so many youth in particular, are really suffering right now. And I also had an interesting conversation with a family member who discussed that her daughter's pediatrician had noted that adolescents and pediatric patients in their practice had lost weight during the pandemic, whereas adult patients had tended to gain weight. And I think the summary of that was, look at what's going on in their mental health. So really good points. And so that's talking about access. And is there anything that you want to contribute in regard to any particular outcomes that you know about? And it's okay if you don't. Okay, so we can move on to question 3.
Well, there's a question posed by our medical director at PCC, Dr. Powell. His question is, he's wondering in terms of access, what you, Maria, and Madison have heard from others or your own experience with regards to telemedicine in terms of access.
So something I've heard just from my friends is when you're stuck in a pandemic, you're in the same house as your family. So having like a doctor's appointment during telehealth is kind of actually really difficult. So that was a big negative for some of my friends and other family members. Just, if you're having like a telehealth gynecological checkup or something, mental health, you don't want to be on the phone call with your mom right in the next room.
Yes, I definitely agree with Madison. In my own experience, over the past semester, I did like teletherapy online, and I'm like living at home with my parents. So it was really, really difficult at times and oftentimes like uncomfortable. So even though I wanted to go, to better my mental health, it was still kind of like, oh, I don't know if I want to go anymore.
Yeah, privacy is a big issue.
Mm-hmm.
Also connectivity, internet ranges depending on if you're on campus or at home. Like I know my parents, they got the low bare minimum internet access out in the middle of the country. So trying to do telehealth out there was probably pretty hard.
And to your point, Madison and Maria, my experience with the mental health system and getting mental health services for youths and young adults are something that I have worked on for many, many years, and something I have discussed with our department head, Dr. Nebo, constantly about how we can enlist services because so often mental health services geared toward adults, right, 18 or older. The challenge is for youths who are 18 or less, or in that age group. And I feel that as a community, it is something that we should seriously giving serious thought to how we can expand that service, because our youths and our young adults experience mental health crisis as well. And we as a healthcare community need to step up and meet that needs.
So for the sake of time, I'm going to keep going. And I'm interested to know what your thoughts are on this question.
For me and most of my friends and other youth people that I know, we are not interested in unmasking at any time soon. So yeah, most of us will be keeping our masks on for the time being.
Same for, my friends and my friend group. Definitely thought it was too soon to do the unmasking. But I also, my cousins live in a more conservative area with more conservative parents, and they follow what their parents do. And so they were never really masking in the first place. And so now they definitely won't mask. So I think it just kind of depends on which environment you grow up in.
Absolutely. Yes. And going to question 4, how do you see youth engagement after the pandemic or once 85% of the population is vaccinated?
I hope to see youth engagement increase after the pandemic, given that the pandemic has exposed a lot of, I guess, problems or vulnerabilities within like our system and different things that need to be changed. I hope that people actually implement the change, especially like, how we were talking about like the healthcare access. So I hope given those improvements, youth engagement will increase.
Definitely kind of going off of that, I hope that a lot of people are interested in the medical field, and just because they're still talking about how there will be another pandemic eventually. So I hope that, the youth kind of see this, and then maybe in the future we'll learn from it, and maybe handle the vaccine rollout differently.
Candace, do you want to present our last question? I will. Okay. So last question, question 5. How have your familial, personal, and social relationships been during the pandemic? What has been helpful and what has been hurtful or not so helpful?
As we mentioned before, I think with like the lack of privacy can definitely be hurtful, but at the same time, being with my family has also given me kind of like an immediate support system. Whereas if I were back on campus, I would be living alone, so I wouldn't have that support system in place. I think with like other personal and social relationships, although I haven't gotten to see many people in person, like my friends, I still feel quite engaged with them over social media. So that's been very helpful.
Kind of in contrast to Maria, I live alone, and my parents actually moved states during the pandemic. So I actually haven't been able to see them in a while just because of the pandemic and not wanting to drive and stay at hotels. So it's been difficult and harmful in that way. But also very thankful for Zoom and platforms like Zoom, because I can FaceTime them, or we actually have a family Zoom call every Sunday that I go to.
To follow up on Maria and your response, Madison, do you find the relationship that you have on social media, what has what have feedbacks from your colleagues or your peers with regards to social media relationship? Have they found them to be helpful, or have there been times when social medias have hurt them? Or isolate them, for example, bullying, that kind of things?
I would say social media has been both helpful and hurtful. Hurtful in a way that sometimes instead of paying attention during class, I've been guilty of this, and my other friends have been guilty of this. Like, we'll just be like on our phones through social media. But in a way, it can be helpful because there is really no other way we can communicate with each other at this time. So I feel like, yeah, it's just like, it's both depending on the situation.
Yeah, for me, social media has been kind of toxic and hurtful in some ways, where, you're just doom scrolling through Twitter and seeing all the terrible things that are happening in the news and people's experiences with the pandemic. But it's also, on the flip side, on the other coin, it's really helpful because you get to see all these inspiring stories and videos of cats and puppies and stuff like that kind of help the pandemic be better. So I don't know, double-edged sword, but I think it's been, again, helpful and hurtful.
Is anyone in the audience have their perspective or their view or feedbacks they have received from their patients or their clients or within their own families?
I just wanted to hop in and thank you both for sharing, your experience during this time. I have a younger cousin who is in college, and she lives at home with her family. And I appreciate the question, what's been helpful and what's been hurtful, because I've seen, being with her family and having that support as being helpful, but it has been hurtful because it's hurt her relationships with her friends, because they are on that other end where they're not following any guidelines and they're going out and doing things, and she's wanting to be safe and she's nervous and scared, and she doesn't know how to talk to her friends and to tell them, because they just kind of look at her like, oh, you're one of those people that doesn't want to go anywhere. So I can see how it's put her in a really challenging place, in a really critical point in her life where she should be, making those friendships and experiencing those things. So I appreciate you both sharing your experience.
Thank you, Kelsey, for sharing that story. I really appreciate that. It's so helpful to hear different perspective, and obviously to know what is hurtful and helpful for our youths and young adults. So often, I think we feel like in healthcare, we're doing what's best for our youths and young adults and our patients. But I do question, how often do we actually ask the question when we give our advice, right? Because just what we perceive to be helpful may end up hurting our patients unknowingly. So I think that asking our patient directly what would be helpful for them and actually listen to the response, I think will help us to build that trustful and relationship with positive health outcome. Luann?
Well, I think that we have 3 minutes left. And are there any other people in the audience who have questions or would like to share anything?
So I was just wondering if Maria, are you, or Madison, are you planning on going into medicine?
I am, yes.
I'm going adjacent genetic counseling. I'm applying to graduate programs this fall.
Fantastic. I tell you what, your experience and your empathy are going to be very well served. So congratulations.
There's one more question in the chat. I just want to make sure y'all saw that.
Yes, so there's a question from Dr. Louis Appel, and his question is, he is wondering if you are hearing enthusiasm or hesitancy about the vaccine from your peers. Thank you, Dr. Appel, for asking that question.
That's a really good question. Go ahead, Maria.
Okay, definitely a lot of enthusiasm. Lots of memes been made about wanting to flex their vaccine cards, regardless of privacy concerns. But for the most part, everyone wants to get vaccinated as soon as possible. And I believe in Texas, they're opening vaccinations to all adults very soon. So a lot of my friends, classmates are extremely excited to be getting the vaccine.
Kind of going off that, my younger cousins who are minors are kind of frustrated that they can't get the vaccine until they become an adult currently. So that's the kind of frustration I've heard around the vaccine. Also, I've heard people expressing hesitancy with the AstraZeneca vaccine, if that ever does get approved here. For the other ones, it's been mostly positive, but I've heard people say they don't want the AstraZeneca one.
And Madison, to follow up on your response to that question, what has been their feedback about or hesitation in the AstraZeneca? What have you heard?
Mostly the recall in the UK and then being back implemented, and then the hesitancy the past couple days with the US, and that they overestimated their efficacy rate and are reviewing that. So it's just kind of that back and forth on, is it effective, is it not, has kind of been like, for some patients. I would have totally be fine with it. I already did get the vaccine, but I just heard a lot of hesitancy for the AstraZeneca specifically.
Dodonna wrote in the chat that she has 2 helpers in the office that didn't want one until one of them got COVID.
So we are at time, and I just want to say thank you so much to our presenters and to our fantastic Youth Advisory Council speakers, Maria, Madison. Thank you, Candace. Thank you, Luann, for being here. And we are going to have a little networking break. So if you go back into the main room, if you want to do some more networking in that main room for the next 10 minutes. And then our next sessions will start, it is 6:40. We will start back up at 6:50. And again, check your emails for the links for the next breakout session in 10 minutes.
Thanks, everybody.
Thanks, everyone.
Thank you so much.
Thank you, everyone.